Okay. So just a reminder, everybody, if you've got any questions, please do put them in the chat. And very big welcome to everybody to this webinar about the air quality targets. We've got two excellent speakers today who may have different points of view. They do know each other, so I'm sure they'll be kind to each other. Delyth Dyne is the Deputy Head of Air Quality and Industrial Emissions at Defra, and Delyth is going to speak first. She's heading up the work on the National Air Quality Strategy and the targets. So hopefully, Delyth, you'll have some explanations for us about some of the things that will probably come up as questions, but maybe they'll be answered as we go along, and then we can pick up on questions before we hand over to Tim, who's the campaigns manager at Asthma and Lung UK, and Tim's heading up the air quality team there. And I will give both Delyth and Tim the opportunity to introduce themselves in a little bit more detail. But Tim hopefully is going to be telling us why we should be more challenging with the targets. So yeah, so let's with no further ado, let me hand over to Delyth to start presenting. I have got a question, somebody saying they can't hear what Delyth is saying. Now, Delyth isn't talking yet, so it's me that's talking, and you should be able to hear me. Can I just ask Tim and Delyth, I assume you can hear me okay, can you?
Yes, definitely.
Yeah. Okay. Emma, from the A27 bypass, I will respond to you if you can hear me. I'll respond to you in the chat. Okay, over to you, Delyth. Do you want to start sharing your screen and give us a quick introduction?
I will endeavour to do so. Just bear with me. I'm afraid I'm having a little bit of difficulty.
Right, did you find, oh, something's coming through, there you go. So you just need to find your presentation now, there we go, and put it onto present mode. And so if you go from the beginning and then you should go on to, right, now we had this problem on a previous session. And I think it was the display settings that somebody had to change. So if you just go to those display settings, Delyth, can you see them on your screen? Up at the top there.
Yeah.
Duplicate slideshow, that's it. There we go. Okay, over to you.
Brilliant, thank you very much. I think I need to go from the start again now though, so let's do that. Okay, thank you very much for having me to talk to you this afternoon. My name's Delyth Dyne. I'm one of the 4 deputy directors in Defra's Air Quality and Industrial Emissions team, working for Bill Parish, who many of you may know very well. I lead on a number of different policy areas within AQIE, and that is on the PM 2.5 target. I also am responsible for the local authority quality management framework and leading with my team on the air quality strategy review. I'm a policy lead, so if there are really highly technical questions, I'm probably not going to be able to answer them, but I can certainly take them away and I can make sure that I can get back to you on that. So what are we talking about today? We're talking about the proposed PM 2.5 air quality targets that are currently out for consultation up until the 27th of June. Defra is proposing 2 targets. That's an annual mean concentration target of 10 micrograms per metre cubed by 2040, a population exposure reduction target of 35% by 2040 compared to the 2018 baseline figures. As I said, the consultation is ongoing at the moment and it closes on the 27th of June, so not much longer for people to get their responses back, and obviously encourage everybody to do so. Why 2 targets? Well, the Environment Act requires us to set an ambient air target for PM 2.5, but there was also a duty to set another air quality target. So we wanted to set 2 PM 2.5 targets. It's the pollutant of most concern and most impacts on health. The concentration target is to drive reductions in area where concentrations are the highest, so providing greater equity and exposure, and the PERT is there to drive reductions in average exposure, so everybody benefits across country. So we're not just talking about dealing with hotspots, everybody will benefit from this. We're also required under the Environment Act to set 5-yearly interim targets, which will be set to ensure continuous progress to the long-term targets, with annual reports on progress happening, as well as the environmental improvement plans, which will also have to be reviewed and updated on a cycle basis. The Environment Act 2021 requires secondary legislation to be set for the targets, and this isn't just for our target, it's for all the other environment targets as well. That has to be put before Parliament by the 31st of October 2022, and the targets must be achievable under the Act. The Secretary of State has to be reassured that these can be met. How are we going to assess compliance from the targets? So progress towards the targets and legal compliance will be assessed using Defra's automatic monitoring network and monitoring sites, which are all across England and indeed the UK. The concentration target will be met if no AURN monitoring sites in England exceed 10 in 2040. The PERT is based on the average of all sites, representative of population exposure in England, and this will be averaged over 3 years. If the reduction from 2018 to 2040 is greater than 35%, the PERT will therefore also be met. We're expanding the PM 2.5 monitoring network in order to help support the targets. We've already introduced 7 new sites, and there are plans to do more this year and in the next couple of years as well. So what are our sources of PM 2.5? Well, these are the 2018 data that I've got here. I haven't put more recent data out because the 2018 data is the data that we actually use in the modelling. So average population exposure in 2018 was modelled to be 9.7 across the whole of England, but that's the average, not a hotspot. 32% of this was from natural sources, such as sea salt, soil, pollen, for example, and 19% from emissions from outside the UK. Of the 49% from man-made UK sources, domestic combustion, road transport and industry made up the majority of those. Proportions will vary across the country. Obviously, they'll be different in towns compared to in more rural areas. We also have secondary contributions of PM 2.5. So 48% of UK contribution is not directly emitted, but produced by chemical reactions with other pollutants such as NOx, which comes from cars and natural gas, ammonia from agriculture mainly, and sulfur dioxide from fossil fuels. These 2 graphs here show represent those emissions as I've just discussed in the pie chart. So contributions from natural sources and other countries and shipping are made up of over half of the PM 2.5 concentrations in the southeast. So the graph on the left shows sort of that background level of pollution that we're actually exposed to with regards to PM 2.5. The right-hand graph shows the UK man-made contribution. Just putting this up to demonstrate that if there were no PM 2.5 emissions from UK man-made sources, 5 micrograms per metre cubed is not possible in all locations across England. What are current target metric values? So in 2018, the highest value for the concentration target was 16 micrograms per metre cubed. 2021, it was 13. PERT, the average concentration in 2018 was 10.3. and in 2021 it was 8.8. Recent figures are lower than, which is a good thing, obviously, but we're not sure at this stage what the possible impacts of COVID and whether we're on these latest figures. So what approach have we taken in terms of actually developing the targets that we've got? So we actually had a lot of workshops and discussions with various different sectors to give us various background information on what current technological advances were taking place in their area, what was the art of the possible. And then we looked at developing some different scenarios, and there were four different scenarios that we developed. The first one was the baseline, and that's based on sort of existing interventions and policies, natural technology turnover. We had a medium scenario, which is based on measures identified by the sector and the implementation of proven technology and monitor behaviour change. And as we go further up the scenarios, that becomes increasingly more challenging. So high scenario is technology considered likely to be implementable in the future, but we need increased behaviour change, more rapid timescales. And then the speculative one, which was the highest level of ambition that we were looking at, is based on all feasible measures, including emerging technology and significant behaviour change.
Delyth, can I just interrupt you before you continue? We're only seeing half of your screen at the moment. Have you got two monitors?
I have, yes.
Yeah, so we're actually seeing the monitor that you're looking at and half of the other one. So can you go back to, can you move over to that's it, go to duplicate slideshow and that's it. Okay, we should be able to see now. And if you can minimize the air quality targets webinar button, that's it. Super.
Brilliant, thank you.
Yeah.
Do you need me to go back over any particular slides, or shall I just push on forward?
No, if you push on from there, I think what we would like is maybe to have a copy of the slides afterwards, Delyth, if we can, and then that people can refer back to them.
Absolutely, there's no problem with that.
Thank you.
Sorry about that. Technology is not my forte. I usually have somebody to help me with this. So thank you very much for doing that. So obviously I've gone through the approach. We developed the different scenarios. We looked at admission trajectories related to those scenarios, and therefore that would actually came up with the air quality modelling and the results, obviously, that we've then put into our evidence pack and into the consultation. So what were the results? So concentrations for 1 kilometre metre grid squares were produced for each scenario and for each year, and we did 2020, 2030, 2030 and 2040. The map showed that the southeast northwest gradient across the country and urban spots, concentrations in London are our highest, which is not surprising because it's obviously a dense conurbation. Decreased UK man-made emissions result in lower regional concentrations and fewer hotspots. Concentrations remains the highest. Modelling is always indicative. There are multiple levels of uncertainty, but I think you can see from the two graphs we've got here, which is how we then determined that it would be 10 by 2040, was that actually 10 by 2040 under the high scenario was the scenario where actually we got a situation where nobody was meeting 10 across the board. Everybody was below 10 across the board, and therefore that was the decision for us to and ministers to actually propose 10 by 2040. Health benefits, the targets are expected to deliver a reduction in population exposure of 3.5 micrograms per metre cube by 2040 compared to 2018. It's estimated over the 18 years this reduction will result in 231,000 fewer cases of coronary heart disease, 75,000 fewer cases of children's asthma, fewer cases of stroke and fewer cases of lung cancer as well. And there are also benefits for the ecosystem in sensitive habitats and in carbon reduction. In summary, the evidence pack, this is a very, very, very quick run through there's a significant amount of more information in the evidence packs for you to look at, and if you haven't looked at it already, obviously I encourage you to do so. But the existing policies will result in PM2.5 going down. Without us doing anything more than we're doing at the moment, things will get better, but we need to do more in order to reach the proposed targets. The additional time to 2040 enables more measures to be implemented. It allows for more certainty around those technological developments, and it should be possible to meet 2010 by 2040 with emission reductions similar to that in the high scenario. This enables a 2040 PER to 35% compared to 2018 to be set, reducing concentrations for everyone. As the previous slide showed you, meeting these targets will deliver large benefits, health benefits, and will greatly reduce the disparities in exposure. And there's quite a lot about disparities in the evidence pack, which I haven't actually covered in this. And finally, technical feasibility is not the only consideration when setting the targets. Ministers need to balance health benefits against economic costs to individuals, businesses, and of government taking action. So that's it. Obviously, I will answer any questions as they arrive in the chat.
We had quite a few questions. Just a very quick one from myself, Delyth. You mentioned that the monitoring would be extended to new sites, PM2.5 monitoring. So is there any specific sites that you're focusing on there, like schools, for example, or, you know?
They are, I mean, what we will be trying to do is get a balance between urban and rural setting of sites rather than citing something individually next to a particular school or such the like. So that's more about local action. In terms of looking at this on a national perspective, we will be looking around the country to see where there are gaps in our current network and where it would be best to place them in order to give that a true representative understanding of rural and urban and allow us to get the best analysis of compliance with the targets that we can.
Yeah, that makes sense. So will there be a map showing where those monitoring stations are then? Will we be able to see where they are?
I mean, there is a map already on UK Air of existing monitoring stations, and as we bring things online, they will be added to that, yes.
Super. Okay, well, let's look at other people's questions. Mark East has asked why the targets for PM2.5 have shifted from the 2025 target that was in the 2019 Clean Air Strategy to 2040 now.
They're different targets. So the target in the Clean Air Strategy, it was about a percentage reduction in people exposed to PM2.5, and you know, we've got a couple more years, but I think we're on course to meet that one, and this is just a new target. That doesn't mean that other one is still not valid.
Okay, super. And Mark again is asking whether new housing developments should only be approved in areas that meet the standards. And now he's talking about the WHO standards here, but I'm aware that many areas which are facing developments will not meet the targets that you're setting either. And in fact, Laura, I think later on asks a question. Do the predictions include things like road projects that have not been granted permission yet? Because RIS2 includes a lot of large road projects. So all these new developments that are being proposed may have a significant, well, will have a significant impact on achievement of the targets.
Okay, so for the first point about new housing, I mean, obviously, there is a requirement as part of planning regulations for people to take due regard to air quality when they are citing these developments, and that will still stay in place. And we will be working with Delyth on anything we can do to strengthen that, and work with them to make sure that air quality is taken into consideration in these decisions. And with regards to sort of WHO standards, their guidelines, and even the World Health Organization in their guidelines say that governments have to take into consideration their local circumstances. I think, as the slide showed, that we have a lot of PM 2.5 that's transboundary, that's coming over from continental Europe. So in the southeast, you're never going to get down to that lowest 5 microgram per meter cubed level. You know, fullness of time, international negotiations on the Convention on Air Pollution, maybe that will be driven down and we'll start getting closer and closer. But you are talking about much longer timescales than we're currently talking about. Nobody's not, you know, make it clear, nobody is denying there are health effects from PM 2.5, but we do have to balance, you know, those health effects against about activities that take place and we have to contribute to as part of society. What was the next question?
It was around the road, the new roads that are being proposed through RIS2.
Yeah, so in terms of the way the target has been set, the target has been based on sort of modelling on historic levels and sort of future trends. So, you know, these should not be a barrier to innovation and the introduction of new infrastructure. But during the development of that infrastructure, people have to take due regard to the fact that they will be have impacts on local air quality, which could be short term during the construction.
Oh, and long term, when you get lots more vehicles. I mean, arguably, really what we should be promoting is sustainable transport rather than building any new roads, and unless they're, you know, access roads to a particular development site. So it's hard to understand how air quality targets will be met if we're going to continue with a focus on building new roads rather than giving priority to sustainable passenger and freight transport options, really. So I think, you know, we're on to a loser there with those. Deborah is asking, the consultation documents cover monitoring, modelling and other things, but how will the targets be regulated and enforced, and will that be part of the upcoming pathways consultation?
Yes, so these are national targets. They're not local authority targets, so they're for government to set out the policies that it needs to deliver them. Local authorities will have a role and they will hopefully play their part in delivering some of these. We will set out as part of the interim targets our policy pathway on how we're expecting to deliver these targets. Work on net zero will be a positive contribution to reduction of some of the PM 2.5s, but we will set out our policy pathway in due course. We will be held to account on these targets by the OEP, the Office of Environmental Protection, and they will as will everybody else, so we'll need to have to do annual assessments and annual reports, and you know, to ensure that we're making these moving forward towards these targets. But it'll be the OEP that will take us to account ultimately if we fail to meet them.
Right, and so it seems like the OEP might be a place for us to challenge, to get some action if it seems that, you know, development and people are talking about the government's target of 300,000 houses, as well as the major roads. You know, maybe we need to ask the OEP how those targets will be met unless there is a change of direction, particularly with roads. I think there's a number of questions about the moving forward the target for 10 micrograms per cubic meter of PM 2.5s from 2040 to 2030. Now, I don't know whether Tim is going to talk about that in his session. So is that something that we should wait till we've heard from you, Tim? What's your thought on that?
Spoiler, but yes, that is
Yeah.
that is something that I'll bring up. So, but
Spoiler alert. Okay.
That's off whatever you want to discuss now.
So
Can
let's leave that one though, unless Delyth wants particularly to come in now.
Well, I mean, it was just an interesting point in one of the comments, which is like, can we bring the deadline forward? Because, you know, we can do, research has shown that it's possible to get 99% of the country to 10 by 2030 with existing planned measures. I'm not sure all those planned measures that I found, if it's in the research, I think it's in, are actually absolutely bottomed out and fundamentally set down and will happen. But at 99%, that's a fail. You know, we won't have met it.
Yeah.
But we can debate that further on.
Yes, I think we can come back to that as we go forward. And I think there are very interesting anomalies in the discussions that that we need to perhaps get a little bit closer to. And Laura will pick up on your point about national highways keep telling us that air pollution disperses within 200 meters from a road. Now that is interesting because there's been some research done about the impact of roads on birds and other wildlife. And I'll try and put a link in the chat, because basically what that research is saying is that bird populations are affected up to 700 meters from a road. And it's the populations that are most at risk which are impacted by new roads. So it's not only people who are affected by air pollution, it's populations of wildlife and birds as well. So I'll try and put that link in the chat in a minute, but let's
just to chip in one point on that. I mean, is that nitrogen dioxide? Because most of the action that national highways have been taking to date has been around roads, has been to tackle NOx rather than actually tackle PM 2.5.
That's a good point. I'm not sure. Maybe Laura will know more. You can put more in the chat, Laura, if you know which pollutants they're particularly talking about there. So Sally is saying, you know, there's lots and lots of caveats in the plan, which is normal, I have to say. How will we, you know, what assurance do we have that the government will actually follow it through, or will there be, you know, other ways of wheedling their way out of meeting these targets? You know, you can't possibly comment, Delyth, can you?
Well, that's all I can say is we will set them in legislation, and that if the legislation will be legally binding, and then we will be held to account by OEP and others if we fail to meet those targets.
Yes, I agree. Okay. So they have to consider is the legal limits, which are very high. So are we saying it's okay to continue exposure? So, okay, so Mark is saying, you know, we've got air quality considerations. This is the local planning authorities are saying the only air quality considerations they have to consider is the legal limits, which are actually pretty high and do impact people's health as well as wildlife health as well. So is it okay to continue to expose people, particularly children and the elderly, to premature death by not taking into account? And I think, Delyth, you said that you're happy to work with DLUC to strengthen the objectives re air quality in the planning regulations, and I think that's something that we can push for. Is there anything more that you want to say on that? Because, you know, it does seem that people's health isn't coming first, really. Oh, you're on mute, Delyth. Sorry, you're on mute.
Sorry, I did. Obviously, I can't guarantee that DLUC will actually strengthen its requirements, but we will work with them as we will work with other government departments and do work with other government departments like BEIS and DFT on net zero. You know, Ministers who will make these decisions also almost ultimately have to take a balance on health and what's needed to maintain society and employment and all the other actions we need to ensure that we have a thriving society. That's probably not very well expressed, so apologies for that. But it is a balance that has to be made, and ministers do that regularly on a number of different areas. And this is the same in terms of particularly on PM 2.5. We are talking to ministers at the moment about how we express PM 2.5 locally. At the moment, there is a requirement to have due regard to PM 2.5 when local authorities are looking at their assessing air quality in their area, and that's something that we're discussing with ministers too. Okay, and I mean, I am going to just take a break in a second and hand over to Tim, because I don't want to steal his thunder on if there's any more questions that that we may cover what Tim is going to raise. But just a small point on the whole PM 2.5 and other pollutants. Is there a number? Let's say, 100 HGVs in an hour, that is the limit that you would, has any work been done to identify at what point traffic, for example, might exceed? And, I know there's lots of other factors that would need to come into consideration, such as, the ammonia factor from fields and things like that. But is there a figure that you could say, if we had, maybe it's 200 HGVs an hour or 500 cars an hour or whatever it is, this would be too many vehicles on the road from a pollution perspective? I think that's really difficult. Define a road. Is it a major motorway? Is it a small country lane? I mean, it's really difficult. There is some evidence, obviously, there is work in the evidence pack which just clearly demonstrates that road transport is a major emitter of PM 2.5. So, that is something we do need to look at going forward as part of our policy pathway. Electrification will help, there is no doubt. But actually, that's not the only issue when it comes to transport, because there is exposure from non-exhaust and braking and stuff like that. So there is technological challenges as well in terms of going forward. But I don't think I could. I mean, I can go back and ask my technical specialist, but I don't think there's going to be an easy answer to that one.
That's that. No, I mean, what's in my head is, if you have a one-lane road, there's going to be a capacity limit. If you have a two-lane road, that capacity limit will presumably double. If you have a four-lane road, that capacity limit is presumably quadrupled. At what point do we get, too many vehicles to ever have an air pollution limit that is within the guidelines? And I'd just be interested if any work has been done on that, because clearly, as we go forward, this sort of evidence will be important as to, before we get to a point that a road is approved. If a road is built here and it is 2 lanes of traffic going in each direction with a capacity of X amount, if it runs to capacity, what will that do to the air pollution? And because that might then shape decisions to move towards more sustainable passenger or freight transport options. But anyway, I will come back to the questions we haven't responded to, but I'm going to hand over to Tim now. Tim, do you have slides to share as well? Or
I do, if I'm able to.
Yeah, so you should have a square white box with a black up arrow in.
This should be it. Hopefully you can see
Yeah.
that.
Yes, we can. They just need to go on to present mode.
There we go. Hopefully it's up.
We're there.
Fantastic. Well, thank you very much, Marge. And thank you very much to Delyth as well for the run through of her presentation and the targets. It's always really useful to see all that again, because it is such a lot of information and background knowledge that's gone into it. I know with the evidence pack she's referring to, I think it comes across 2 pages, and that 2 documents, and that comes up to about 200 pages. So all in all, it's quite a lot of dense information to get through. So a short little refresher like that's always appreciated. So I'm here today, obviously, to talk about this as well from our side at Asthma and Lung UK, what our perceptions are of the Environment Act, what of the targets that have been set through the Environment Act, but also just to discuss a bit more broadly of why this is important, not just to us as an organisation, to the people that we represent, but essentially to everybody, and why, what's the reason that we want to see more ambition on this topic. So as a brief introduction, for those of you who may be unaware of us under our new name, Asthma and Lung UK, we are Asthma UK and the British Lung Foundation Partnership. We, a few months ago, finished our process of merging together into one organisation, now working as Asthma and Lung UK. And under that, we're setting out a new strategy of trying to fight for respiratory health right across the country, tackling some of these big issues that we see. So 1 in 5 people in the UK will experience a lung condition at some point in their lifetime. Poor lung health is the 3rd biggest killer in the UK. We rank extremely low down the list in terms of how successful we are on treating and diagnosing lung health in Europe, and that's something that is an absolute priority for us to fight for. Every 10 seconds, someone in the UK has an asthma attack, and every 5 minutes, someone dies from a lung condition. At the moment, less than 2% of public research is invested in lung health conditions. This is substantially lower than other conditions such as cancer or heart disease, despite the fact of how much it contributes to mortality in the country. So it's only fair that we feel that we kind of get the same, the equivalence of research funding to actually help people to reduce mortality, but also improve people's lifestyles for people that are living with lung conditions. Not having this obviously means that we have a huge pressure on our health systems. People miss out on support when they need it the most due to poor diagnosis or lack of clear treatment. There's little improvement in outcomes for people with lung conditions over the course of the last decade. But most of all, many of these lung conditions are preventable. And in many ways, that's why we are part of the fight for clean air, because we know just the impact that toxic air pollution can have on people's existing lung conditions, but also causing new ones. So far to date, we've done a lot on campaigning for clean air. So we've been attempting to influence national policy. We were calling for air quality targets to be included in the Environment Act. We're always calling for bolder clean air laws at a national level, and we always look to promote a health first approach on the focus from exposure reduction. So really making sure that you're benefiting those people who are impacted by air pollution the most. So that is people with a lung condition, that is people who may have underlying health conditions, but also children, pregnant women, the elderly. We have a programme of local and digital mobilisation. So we have 1,000 campaigners across UK cities, with many more thousands that join us to sign digital actions, calling on politicians and political leaders to do more, and again calling for bolder local policies. This is something, while we have this kind of discussion at a national level, there is so much that can be done on the local level if there's the political will to do it, and also the framework in which people are able to achieve it. And then improving health advice as well. Unfortunately, air pollution isn't necessarily kind of given the credence, or doesn't necessarily have the due understanding that it deserves amongst healthcare professionals, and we think it's really important that we help to provide that education, so that when somebody goes to their GP with breathlessness, that it's taken into account that potentially this may be due to where they are. If they're living near to a busy road, is that impacting their health condition? Is it worsening it? Is it a trigger for their asthma? and then just also improving the treatment pathways once you start to get that diagnosis and you start to manage your condition. This is also something which there is massive interest in. Kind of this is just a slide to show that in terms of what the media focus there is and public interest, that air pollution is something that people do care about. You know, whenever there is a story, whenever we're releasing new information, new research, as we'll be doing next week, it's something that does hit the headlines and people are interested about it. And it is this complex subject which has a lot of confusing terminology, a lot of confusing statistics around it, but people do have the basic understanding that air pollution is bad for them, it's bad for the people around them, it's bad for people that may already be suffering from a breathing issue, and they want to see action on it. So it's just helping to ensure that we're explaining to people exactly in what way it's bad for them, how it's currently kind of how it currently exists around them and in their area, and what can be done to tackle it. So protecting the most vulnerable. We know that air pollution is linked to 36,000 premature deaths every year. As I said, it can create new lung conditions, it worsens existing ones, and some people are more vulnerable than others. It also has a greater impact on people from deprived areas. We know that that people living in deprived areas are far more likely to be living in an area that has higher levels of air pollution. They're also significantly more likely to suffer from a lung condition or be living with a lung condition. And this is generally because of where kind of poorer communities exist. They exist in those traffic corridors, nearer to industrial sites. So this is something that is a social justice issue, in effect, because they're the ones that are dealing with the impacts more, despite the fact they are statistically less likely to be a net contributor to the issue. They're more likely to use public transport, less likely to own and drive a car. So despite the fact that they're contributing less to the issue, the people in these poorer areas are dealing with the impacts a lot more significantly. Here are the facts. In fact, 7 times more likely to die from a respiratory condition in the poorest compared to the richest neighbourhoods. 85% of people living in areas with illegal levels of NO2 make up the 20% poorest of the UK population. This is despite those on lower incomes being less likely to own a car, also less likely to go on holiday and take a plane. 54% of those on the lowest incomes have uncontrolled asthma. So that's asthma that they're not taking correct medication for, that's not being managed sufficiently. And you don't have to take our word from it. Every year, every year we speak to our beneficiaries, asking them what it is that they're currently seeing to do with their condition, how it is that they're managing it, what it is that's triggering it. And 88% of people with a lung condition tell us that it affects their lives and well-being. So that's to say that it's causing them breathlessness, that they change their behavior because of it. They actively don't go outside if they feel that the air pollution is bad. If they get an alert, they're unable to go outside to exercise or potentially even just take a walk, or even if they're in their homes, are still impacted by it. This is one particular case of Leon from West Lancashire. I now have COPD and I'm slowly suffocating. People should know exactly what bad air can do to your body. It will kill you. It slowly creeps up on you to the point when it's too late. Your lungs become diseased. It cripples you and it will just get worse. This is a quote from Leah, who's a mum to a 7-year-old with asthma, Lucy, who lives in Birmingham. It is a horrible thing to hold an oxygen mask over your 3-year-old's face to make sure they're getting oxygen, to see your child gasping for air as doctors fight against time to find a tiny vein. And as I say, this is just the tip of the iceberg. We hear from people on a daily basis, from people who contact our support lines, which is a 9 to 5 support line, which is staffed by trained nurses, or getting in touch on the internet, and we have thousands of people that visit our pages every day to look at kind of what they can do to protect themselves. And these are just some examples of the stuff that we hear back from them. So, I mean, we do hear a lot of statistics about air pollution, and going back to what we're talking about, that kind of public interest, there is there is so much more, I think, that can be achieved just by showing exactly what it is that it means to people on a personal level, and those kind of case studies and examples that people are willing to share is so powerful, and hearing them, sort of reading them just written down then kind of really does have an impact on you, and we're hearing them kind of firsthand really does have a massive effect. So you do just get to start to understand exactly what this means for people and why it's so important, and that's why we're fighting for clean air both at that national and regional level. So some further patient insights of how people, oh, sorry, I've just clicked off my slides, of how people are kind of trying to manage their conditions. People don't necessarily know that air pollution alerts exist at the moment, and that's something that we're continuing to raise greater awareness on. And over 70% feel that central government and local authorities are not doing enough to protect people from air pollution. Wary of time. And these are just some more stats about air pollution across the country. So this is a location of obviously where these kind of vulnerable groups are, you would expect to find them, or where they're working, or playing, learning, and where they're receiving treatment. So that PM 2.5 above 10 micrograms per cubic meter, our research that we conducted last year found that 29.3% of hospitals are in an area that breached that 10 microgram limit. Currently 26% of care homes, 30% of schools, and 37% of GP surgeries. And just for a kind of comparison, if you take that down to 5 micrograms per cubic meter, that's effectively the whole country. That covers everywhere. So the new targets. As we've just heard, the government is proposing that national air pollution levels should be 10 micrograms per cubic meter by 2040. Now, this obviously gives us 18 years until we reach that date. So this would leave an entire new generation growing up breathing, or not necessarily breathing cleaner air, but breathing dirty air. And as we know from what the new WHO guidelines, I think just as significantly of the reduction to 5 micrograms within that recommended guideline is the note that there is no safe limit. There is no safe limit of air pollution that you should be breathing, and therefore we should do everything we can to reduce exposure as significantly as possible. And as people have said before, we know that this can be achieved much sooner, by 2030, that we can have these world-beating targets. And I think as part of our research into the technical information that's been released, the government or Defra have said that we can reach 11 micrograms by 2030 under their current ambition level. So we're not quite clear why we're expecting to take another 9 years to reach that extra microgram, and why we can't have the ambition to get it below that 10 microgram period by 2030 with some more ambitious policies. So actions that can be taken now to be more ambitious means that we're not just kicking the can down the road, and that we're implementing policies sooner that are going to help us to get there, but don't make it harder later. So local transport's obviously a great example of this. There is, right across the country, particularly outside of London, there is great improvement that's needed to local transport infrastructure, both in terms of active travel, but also public transport. If we start to have policies that are built around this 2040 target, are we necessarily going to be implementing the right policies as we build those plans and strategies that are going to reach it sufficiently? That, you know, this does cascade down through every other policy and every other area that government at a national and local level is working on. And not only will it help to save time, but it also saves money by starting to we're not reviewing this again in 10 years time, looking at how we can look to achieve it. And most significantly, the impact that it will have on millions of people with a lung condition. By reducing these, we're helping to protect, by reducing these air pollution levels, we're helping to protect people, protecting lungs, protecting their exposure, and protecting the damage that is having to their ability to breathe. For those of you who haven't seen it yet, who are unaware, we have actually created a tool to be able to help as many people as possible respond to the consultation. If you go onto the government consultation page through Defra, you'll see that there is a lot of other things that are bundled up in it. As Dylan was saying, it's kind of there's lots of things that are being consulted on as part of this secondary legislation process. For people who are interested on specifically responding about the air pollution section, we have been speaking to Defra and they've been happy for us to collate responses, and we'll be providing and sharing them with Defra to include afterwards. So if you're interested in doing that and kind of seeing some more of the information of what we think about the targets and where we stand on it, you can go on to envirotarget.uk by the 27th of June and join the already 4,000 people that have responded, and we're looking to get plenty more with Clean Air Day coming up around the corner. So thank you very much for that, and obviously very happy to take questions if there are any.
Super. And yes, we've got a bit of feedback. We'd encourage everybody to respond, particularly given the strength of feeling that there is around this 2030 target. And I think maybe if we can come back to that one. Very interesting. Yes, and Tim, we've got a question. Can we have your slides too? You'll be happy to share those, and then we'll send them out to everybody with who's registered. Super. So I mean, from my perspective, Tim, one of the things that I did feedback in the government's Human Rights Act consultation that was recent was that we should have the human right to breathe clean air, and I don't know whether that is something that you've done, but given that they are looking at Human Rights Act at the moment, it is something that we should be pushing. And I think if we can bring all of these different bits of government legislation together, then we may get a good result for people. And just moving back to that 2030 target, and I would be interested in perhaps Delyth saying, you know, why is it not possible, Delyth, to, or if enough people come back in the response and say we should be able to meet the 2030 target, is it something that you'll look at again?
I mean, it's definitely something we will look at, because that will be in the government, you know, will be in the response. We will have to look at that alongside any other comments and responses that we get that may be challenged 10 by 2030. So, you know, definitely be looking at it as part of the analysis of the whole package of results that come from the consultation. And I too would encourage everybody to have their say. That the whole point of having a consultation is to make sure that we get everybody's views on board, and that we consider them when we present that information to ministers when they make their decision. Super.
I mean, Tim, do you want to say any more about that 2030 target?
Yeah, I think it's as has been said by people in the chat and in the presentation, it's just the, you know, we should be looking to be as ambitious as possible, both in this process and in the next one, and in the subsequent kind of policies that we look to implement. And you know, we can understand that while there may be some concern about exactly what's, you know, are we able to absolutely achieve it everywhere? I mean, we should be having that conversation now that yes, we should be looking to have the ambition to be able to achieve it everywhere. And if we feel that the policies that are already in place are getting us very close to it, what else do we need just to get us over that line? And this is something that, you know, because of that, part of that reason of what the World Health Organization has said about there being no safe level, you know, this needs to be part of a process. That 10 guideline at the moment is a transitory target. It's one to be reached as you look to consider further reduction beyond it. So rather than waiting to 2040 before we even get to that next stage, let's try and get there sooner so we can start reaching that next stage even sooner as well. This is part of a longer process.
Yeah, no, I agree. And I think clearly if we can have an aspirational target to achieve by 2030, then that might spur on the move for modal shift from the car to sustainable passenger and freight transport, because I think we'd need to do that to achieve achieve these targets. So worth everybody responding and pushing for this 2030 target, I think. We have, anything final that you want to say on 2030, Delyth?
Not actually on the 2030. There are two targets being consulted on. One is the concentration target. The other one is the population exposure reduction target. There are places within England, because the targets only apply in England, particularly as you've moved further away from the southeast, where people are already meeting 10. And it's been really quite not heard an awful lot about whether or not people think the PERT is the right thing to be doing. So we're driving down exposure all across England, not just the difficult hotspots. I mean, the whole point of doing the two together was to stop that perverse behaviour, which focuses people on just the places where it's really high so you can get them to meet a number, but actually benefiting all. And I'm not hearing anything from the consultation, and I do understand the strength of feeling behind 10 by 2030, but I was just interested to see what people felt about that as well.
Yeah, I don't know if anybody's got any comments on that you want to put in the chat. Just very quickly on a couple of other questions that that did come up. While people are putting something in the chat there, we did get a question asking who is checking that these targets are met. You know, it's all very well, because obviously you will all be aware that the Greater Manchester area has had a very well publicised clean air zone that's gone by the wayside, and the government is now requiring a much smaller clean air zone in the centre of Manchester rather than the 500 square mile clean air zone that was proposed in Greater Manchester. Whichever of those is implemented, who would monitor that they are achieved? Because it seems like local authorities don't have resources, and a lot of the information that's published, particularly in Greater Manchester, suggested that the targets were green already, which is not the case. So, you know, the information that's published online isn't necessarily the information that you would want to use for monitoring purposes. So, any comments on that, Delyth?
I don't know an awful lot about the Manchester CAS situation, and obviously it's been very
sensitive, yes.
No, just a lot of discussion around it. Local authority, and it depends what you're monitoring as well. PM2.5 is a complex air pollutant with a number of different sources, and therefore monitoring of a very local level is more challenging. And so for these targets, we will be using our monitoring network. And EA are responsible for supervising that network. We will be able to use them to assess compliance with the target on an annual basis, and we will report on those annually as well. So, you know, we will do that work to ensure that the targets we set are monitored and reported on. Not hugely so much more of an expert on CASs, but local authorities and nitrogen dioxide, they have diffusion tube monitoring and they have local monitoring networks. So I would expect them to do some of that monitoring if they've brought in a clean air zone, but it could be a bit of mix and match on both.
Okay.
Just on that as well, Marge, well, I suppose there's 2 points to it. On the monitoring, this is something, so I think under the current plans, there's a suggestion that we kind of move just to monitoring and away from modelling. Is that right, Delyth?
So for the concentration target, it'll
Yes.
be based on monitoring only, and that was on the basis of advice that came from AQUEG. For the exposure reduction target, that is based on population weighted exposure, so that is more of a modelling approach. Yeah.
Yes, super. Okay, so within that, I mean, I think that we're still just waiting for kind of further information of exactly what that monitoring structure might look like if we're moving away from the modelling, because the modelling has kind of been the baseline so far. And with the monitoring system that's in place, there are concerns about whether it is kind of sufficient to actually be able to cover it. And without having that further information about what it might look like, it's hard to say if if we think it's going to be effective enough. In terms of Greater Manchester, I mean, that's a very big issue in itself that we could speak quite a while about. It seems to be, from our perspective, it's very, very unfortunate, because there was something there which was extremely ambitious. It was extremely ambitious in terms of its size. Having a clean air zone of that scale over such a big area was something that was an ambition to be applauded. It, of course, didn't include private vehicles, but it was still a very good step in the right direction. It's kind of fallen in between this political gap where the local leaders and the national government have fallen out and used it as a bit of a stick to beat each other over the head with, which is very unfortunate. And the people that are going to be impacted by that are the residents of Greater Manchester. There's still some discussion about what the next steps are and what's going to come of it. We really want to try and make sure that now, especially with the other side of some big local elections, that people are able to put those particular political persuasions aside and come to a reasonable solution and actually do something that will be to the benefit of people in the city. In terms, when it comes to those kind of what you're saying, Marge, about getting green lights all over the place, this can be a big difficulty when you have all these different monitoring systems and structures in place that are held by different local authorities, by government, by private companies, by private individuals that are doing their own monitoring and posting them online. It becomes incredibly confusing, because, as Delyth said, it's an incredibly difficult thing to actually monitor and to monitor it effectively. And that's something that really, I know Defra are looking at what their monitoring process looks like at the moment, and that's something that I think really needs to be combated, just so people have that information, and they have that information that can be really relied on and trusted, and that can be used to inform decisions politically and for people individually.
Agree. And I mean, I agree, it is complex. We do air quality monitoring locally and have nitrogen dioxide tubes. And in one place we had a tube that measured 39.17 in a month. Now, obviously, clearly what that suggests is that at quite a lot of the time during that month, it is exceeding the 40 micrograms per cubic meter for nitrogen dioxide. Because when you take a full day into account, clearly you've got 24 hours of which some parts of the day there's very high air pollution, and then you've got overnight when the air pollution is perhaps lower. But the times when the air pollution is very high is the time when people are walking about in it, and I think it is. So to all intents and purposes, that particular junction didn't exceed the 40 micrograms per cubic meter figure, but actually it did, because it's measuring an average over a month, and we need to really understand the data that's being shared with some of this stuff, I think, as well, because it's not just the different types of data and the nature of the data. It is the data that is actually being shared in some of these systems. And yeah, so anyway, I think we've got some other questions. I'm only going to take one or two because I know we're over the 5 o'clock slot, and some people may have to go. Deborah says, on the PERT, you say that going further or faster with respect to the target levels or dates would require much greater restrictions on society and increased costs for an increasing smaller benefit. But you also say that even very small reductions in PM 2.5 would have significant health benefits. Dirty air affects 97% of homes, according to the Central Office of Public Interest. If Defra agrees that toxic air is an emergency nationally, aren't the costs worth the benefit? So are they? That's a question to you, Delyth, I think. And you're on mute at the moment, Delyth.
Of course I am. Yeah, no, I mean, that is a point I would suggest you put forward into the consultation so that we can take those points back to ministers and let them make the decision based on what collectively people have said. Okay,
I think it's a really good point, Deborah. So if anybody doesn't have Teams on their system, although you will get a copy of the recording, it might be easier to cut and paste that now, that particular comment in the chat. We do have a couple of other questions. Let's just see. What else do we have? Yes, indoor air quality is also a significant issue. Are there any plans to address this? Any plans, Delyth?
So indoor air quality is the responsibility of Department of Health, but AQEG have recently been looking into indoor air quality. So they've been reviewing the research. So hopefully that will be published fairly soon, and then we'll see what happens next from that.
Okay, super. Well, listen, I'd like to take the opportunity to thank you both for coming and speaking and answering questions and being so generous with your time. Is there anything that either of you would like to say in closing, other than to encourage everybody to, of course, respond to the consultation one way or another? I mean, that's just what I would say. Appreciate Tim's contribution to this. People like yourself are really going to be important to promote the need to improve air quality. There, government has made a statement, that we know this is an issue and we do need to do more. So please actively contribute to the consultation, and anything that you can do to just promote awareness has got to be a good thing. Brilliant. Okay, Tim, anything from you before we close?
I think directing people to the consultation is always a great note to end on. And thank you as well to Delyth for coming and explaining. As I said earlier, it's always useful to have a good rundown of what it was that's being proposed. And as well, I think for everyone, it's always important to obviously not just respond to the consultation, but be vocal about this and have conversations, tell people, include it in anything that you're doing. I know people are doing lots of campaigns here, but a lot of the activity that we do and that we want to do is sometimes there is a desire to do this at lots of different levels by lots of different people. It's just making sure that that gets heard and that we're providing a place for more action to be taken on this. Manchester was a great example because there were quite often wrong arguments being made about how it's going to impact local businesses and affect others, and that just overtook the narrative, and that was one of the many reasons why it kind of didn't follow through quite as fruitfully as we hoped. So being able to be loud about this is really important. So keep making noise, bang the drum.
Noise, yes, and I would say that to all the campaigners, exactly, because there is a lot of concern out there that we've got housing and employment being put in greenbelt sites and greenfield sites that are isolated, and the only way to get there is by car, and the only way to get products in and out is by HGV. And the lack of focus on passenger and freight sustainable transport is astounding, given how important this agenda is. So I know I bang on about that all the time, but please do raise that, guys, in your responses, because it is important that we don't end up with our countryside concreted over and all these HGVs just going on local roads instead of using other sustainable means to transport all the goods that we now want to have delivered to our doorsteps. Okay. Thank you, everybody, for coming along. Really appreciate it. Thank you so much, Delyth and Tim, and really enjoyed that session. Thank you.
Thank you very much. Thanks, everyone.
Thank you.
Bye-bye.